Jim, thank you so much for sharing your experience and your perspectives. Jim, you're an amazing man. You centered us with why we're here and the important work we need to do over the next few days. I can't thank you enough for coming and speaking to us and taking time out of your very busy life. I'm just looking to see if Fred is here. Ah, Fred. I am pleased at this point to welcome Fred Horne to take over the moderating duties. Fred Horne is a national and international thought leader with extensive experience in health system policy, transformation, policy development and coordination, and stakeholder engagement. A frequent speaker and panelist on health system issues in Canada, Fred served as Alberta's Minister of Health from 2011 to 14, where he oversaw an $18 billion health budget and Alberta Health Services, and the province's health delivery organization is the 5th largest employer in Canada. Currently he is principal of Horne & Associates, Public Policy Consultants, an adjunct professor at the School of Public Health, University of Alberta. Fred holds an MBA from Royal Roads University and a certificate in dispute resolution from York University. Welcome, Fred.
Good morning, ladies and gentlemen. Thank you for accommodating the slight change in the order of the program this morning. It's a very great pleasure for me to be here today and have the privilege of moderating these proceedings over the next few days. And I must say, and I'm sure many of you are feeling the same way, to have heard, and I managed to catch most of your remarks, Mr. McKay upstairs, to feel the humbling effect of those words and the call to action that faces the leadership in this room and this entire country when it comes to the question of how we improve access to palliative care for Canadians. I will tell you just briefly that, as someone that's worked in health policy for many years, but actually more so as Minister of Health, I was struck by the number of Albertans that spoke to me about their personal experience caring for a family member or a loved one, about the struggles that they faced, in some cases what I consider to be needless struggles or issues without a reasonable explanation or rationale, but that in fact made their lives very, very difficult. And as I reflected over the 3 years that I was minister, my conclusion at the end was that palliative care is far too much an orphan, if you will, of the healthcare system in Canada. It is something that is too often regarded as a very specialized or peripheral service in the system. It's not discussed very extensively among us as a society, and it needs a proper home in the healthcare system. It needs to be integrated. It needs to be part of the mainstream, and so those are some of the reasons that I feel so privileged to be a part of this conference. I will get to a number of other introductions in just a moment, and including the chair of our lay panel, but I do actually have the responsibility of giving some housekeeping announcements, which I'll get on now with, if you don't mind. Just give me a second here. Karen Macmillan and I have completed over 20 interviews this morning on CBC morning shows across the country. I'm told, heard Carleen mention earlier, that we have 157 sites that are connected to the conference, and I think that you can feel very comfortable that you have the attention of Canadians. So, if I could, by way of housekeeping, a few general announcements. It's very important for the web audience that we have that we start each session on time. We ask you to please keep an eye on the time during the breaks. Buxa Associates, who are running the conference, will ring a bell at the end of each break, and that will be your signal to return to this room. We will need to end a few minutes early today for logistical reasons, so we'll be aiming to wrap up at about 4:50 p.m. this afternoon. There are a number of wonderful exhibits at the back of the room, and we invite you to take some time over the next few days to check those out. There is an error to note in the program on page 8. The complimentary Wi-Fi username and password can be found. However, the password is not correct. instead of PCM 2016, the password is actually PCM 2016 with an exclamation mark. So I'll ask you to take note of that. On the third floor, and I haven't had an opportunity to visit myself yet, but on the third floor of this building in the Rideau Salon, you will find the St. Elizabeth Reflection Room. This is a place that's been designated to pause and reflect and share your experiences with dying and death. I understand it's quite a remarkable environment, and it's been provided for your comfort, and we encourage you to make use of it. That's the St. Elizabeth Reflection Room on the third floor. At the beginning of each presentation from the scientific experts, their PowerPoint presentation and a summary of their paper will be posted on the website. That's palliativecarematters.ca. So as soon as our expert begins, those materials will be available to you there as well. And we really want to encourage you to share and interact by social media throughout the conference. You can follow the conference on its own Facebook page, which is Palliative Care Matters. And on Twitter, the Twitter handle for this conference is @PalliativeCM. So the word PalliativeCM. And finally, just some general items. The washrooms, as you may or may not know, are located outside the ballroom just to the left. And if you have not already done so, we'd ask you to please turn your cell phones to vibrate mode and to leave them there for the duration of the time that you're in this room. We thank you in advance for that. I'm now delighted to introduce a woman that's been working, who I've known for many years and respected for many years, but has been working alongside me since 5:45 this morning with these interviews that I mentioned, and that is Carleen Macmillan. Karen is our conference co-chair. She is the Senior Operating Officer and the Executive Lead for Palliative Care at Covenant Health. Many of you in this room will know Karen. You will know, therefore, that she brings a tremendous passion for mentorship and ongoing and quality improvement to her leadership role at Covenant Health. Karen is a registered nurse. She's the Senior Operating Officer for the Grey Nuns Community Hospital and the Senior Lead for the Palliative and End-of-Life Strategy. She's been engaged in palliative care research and education for over 20 years. She's published extensively in this field, and one of the things that I admire the most about Karen is that she has been delivering care as a nurse for many, many years. She has the unique credibility of being able to say, I understand, I have an idea that might help you when you present a particular health system issue to her. And she has a tremendous following both within her organization and nationally. She was the recipient of the Caritas Mission Award in 2008 and the University of Alberta McClure Award for Nursing in 2007. Karen holds a certificate in adult and continuing education and bachelor's and master's degrees of science in nursing. So without further ado, I'd like to ask Karen to bring greetings on behalf of Covenant Health.
Thank you, Fred. It's kind of hard to bring greetings after listening to Jim, and as Fred indicated, we were able to hear you by webcast at the beginning of the presentations. We're doing interviews, and then also to join you down here in the room, and your story really touched, I know, every one of us in this room and people who are listening across the country. One of the things I do want to say is, number one, I am never going to be a morning reporter, because 5:45 in the morning came a little bit too soon. And also all that talking as well, so I think I'm losing my voice, so bear with me if I crackle a little bit. But important conversations, and one of the things that Fred and I were able to do with those 20 interviews was to give people the website, the palliativecarematters.ca, and ask them to join us by webcast. So I'm hoping that many more Canadians will be joining us over the next 2.5 days and sharing their stories and asking their questions, and that it becomes a more fulsome conversation across the country. So I am honored and humbled to have been in your presence, and my greetings will be very succinct so we can get on with this amazing conference. So I'd like to welcome you all this morning to this Palliative Care Matters Building National Consensus Development Conference. This is the second phase of 3 where we, as Canadians together, decide where we want our palliative care to go. It's my pleasure to bring greetings to you on behalf of Covenant Health. We're part of Canada's largest Catholic healthcare provider. We deliver healthcare in Alberta as part of Alberta's integrated health system led by Alberta Health Services. As an organization, we are called to care for those most vulnerable in our society and for people when they are facing the most vulnerable moments of their lives. This is part of our mission. Palliative care is part of Covenant Health's heritage. It goes back to our roots. The first sisters who came to Alberta with a calling to dedicate their lives to care and sick of the dying and the vulnerable, and that was over 150 years ago. It was the Grey Nun Sisters who recognized the need for palliative care in Edmonton and established the first hospital program based at the Edmonton General in 1985. And that's my roots of over 30 years, almost 30 years in palliative care. Today, we are pleased to say that we have introduced the concept of a comprehensive, integrated, and coordinated palliative care program in 1995. This model has increasingly been recognized as best practice in most countries. We have our world-class tertiary acute palliative care program at the Grey Nuns Hospital. We have 119 palliative beds in the province, and many of our facilities offer care at the end of life. And yet, we still have work to do in Alberta and in Edmonton. I was going to share with you my story, but I think I won't. Jim's story was amazing, and I would like the opportunity to share with people over this next 2.5 days my stories and to hear your stories, because I honestly believe the way we learn and the way we grow is to listen to each other's stories and understand what it means for each and every one of us. So with that, please excuse me, and I want that conversation to continue over the next 2.5 days with each and every one of you in the room, because I'm sure all of you have stories. I'm most proud of the Covenant Health Palliative Institute and our robust palliative care strategy. That strategy is focused on providing leadership by identifying ways to integrate clinical, research, education, and administrative services to best serve patients and their families. Coordinating efforts that maximize how resources are used, build service capacity, and ensure that we are at the forefront in developing best practice. And fostering networks internationally and nationally, internally and externally, such as this conference here this week. This strategy is taking us to new directions in Alberta as we work to strengthen our palliative care approach across Covenant Health. Our work has brought us here to Ottawa. If you want to improve healthcare system, then ask patients and families. A consensus development conference provides us, Canadians, with the best evidence, science, and medicine has to offer. It's important to acknowledge the work and recommendations of those who have stood before us. On average, one national report has been published in each of the last 20 years, and yet we're still here 20 years later looking for a national strategy. It's time that we had a national strategy, and it's up to each and every one of us in this room and on the webcast to make sure that happens. We're building on this important work. We are here to speak up for increased support for palliative education, research, and care. It is why we are here today. Why now? The need for access to consistent quality palliative care across Canada has never been stronger. Consider the questions that have been posed for this conference. Consider the lack of awareness and information about palliative care. Consider the inconsistent access to quality palliative care across Canada. Consider that some 96% of Canadians support palliative care. And consider that 1 in 4 Canadians is caring for or has cared for a loved one who is dying. We are all here to talk about palliative care and why palliative care matters. The verb to palliate technically means to make a disease or its symptoms less severe or unpleasant without removing the cause. Without removing the cause. This is an important distinction in healthcare. Whether it's in hospital, hospice, or home, we seek to address physical, psychological, and spiritual needs of those suffering from life-limiting diseases. Our main focus is not to cure, but to provide care and caring that is focused on comfort and caring, again, compassion, in its fullest sense, to walk with patients, residents, and their families, being with, as Jim so eloquently spoke a few minutes ago, with love and humility. Today, I would like to welcome everyone to the conference, from those who care or have cared for loved ones, to those who study and research better ways to provide care, to those who deliver the health services professionally, to those who advocate for better care, for all of us, because we're all in this together. I would like to especially thank and welcome all 13 national and regional organizations who have helped to contribute to this initiative in effort, in content, and with financial support. This groundswell of support is evidence that this discussion is highly important to all of us. I look forward with anticipation to the consensus statement that will be read at the end of the conference by our panel. Thank everyone here for your participation, and I wish you a productive discussion over the next 2.5 days. Thank you.
Thank you very much, Karen. Before I introduce our next speaker, I wanted to draw your attention to an insert in your program, a letter of welcome from the Honourable Jane Philpott, Minister of Health. If you have a minute to read the letter, you will, I'm sure, be as encouraged as I was to hear her once again reiterate how important she perceives palliative care to be in the context of health care in this country. You'll also note that she's referenced the federal government's commitment to $3 billion for home care and indicated that that includes palliative care. And so with that minister's support, and I've had the opportunity to talk with her about this a few times, it brings me great pleasure to introduce our next guest, who will be bringing remarks on behalf of the Government of Canada in place of the minister, who unfortunately couldn't join us in person this morning. Marcel Saulnier is Associate Assistant Deputy Minister of the Strategic Policy Branch at Health Canada, where he is overseeing work toward the development of a new health accord. He has held other senior positions at Health Canada, including as Director General of Healthcare Strategies and Director General of Policy Coordination and Planning. He played a key role in supporting the work of the Federal Advisory Panel on Healthcare Innovation, which released its report in June 2015. Marcel's career has included policy leadership positions at the Canadian Medical Association, the Prime Minister's Office, Finance Canada, the National Forum on Health and Welfare Canada. Marcel is a master's graduate in economics from l'Université de Montréal and a bachelor's of economics graduate from the University of Ottawa. Before I give Marcel the podium, I have to publicly thank Marcel for the support and the leadership that he has provided, not just in recent weeks, but in fact over the past year, to make this conference possible and to fully engage on behalf of the government in this very important initiative. I was delighted to meet him about a year ago. His support has been relentless, and without any further ado, I'd like to call on Marcel to bring greetings from our government.
Thank you very much, Fred, for that very kind introduction. I bring very warm greetings from Minister Philpott, of course, who couldn't be here today. Bienvenue à vous tous qui êtes venus.
Welcome to all of you who came from all four corners of the country, for some of you from other countries, so welcome to Ottawa.
Pleased to be here representing Health Canada, one of the sponsors of this important event. I'd like to extend my thanks to the organizers and other contributors for making this conference possible. It's wonderful to be here with such a dedicated group of people who care about advancing palliative care and end-of-life care in Canada. I'm impressed with the diverse representation and attendance, with each of you bringing unique perspectives and experiences to the table. There's an important conversation going on right now across the country about the need for access to quality palliative care for all Canadians. I am confident that the discussions that will take place over the next 3 days will enrich this national dialogue. And there's also another important conversation taking place across Canada right now, and it's about what Fred was talking about, the health accord. And that is about the idea that governments across this country can come together and focus on areas that they feel need the most attention to improve the quality and accessibility and availability of healthcare for Canadians. And one of those areas is home care, and our minister has been very strong in her view that advancing quality palliative and end-of-life care is part of that agenda. And so this conference really is at the intersection of those two very important conversations. So I urge you to champion what's working well in your area of the country as you talk with each other and listen to each other over the next few days. Contribute your ideas and examples so that we have and may learn from one another. At the same time, I also urge you to be creative, bold, and innovative. You never know where the next great idea may come from. Those of us at Health Canada, and there are several of my colleagues here today, will be paying close attention over the next few days. The final report that emerges from this conference will help inform our work, and I hope that of yours as well, as we continue to explore ways to improve palliative and end-of-life care for Canadians. Thank you, and I wish you a very productive conference.
Thank you very much, Marcel. Ladies and gentlemen, I have some prepared remarks here that I want to read. We're going to talk a little bit about the CDC model, Consensus Development Conference model, and the Palliative Care Matters project. And while I realize that a number of you in the room will have this information, there will be many people, I think, joining us by webcast and that will review the recording of this conference later that also would greatly benefit from hearing some of those explanations. As you may know, consensus development conferences are very different from other conferences, particularly other types of healthcare conferences. The consensus development conferences bring together citizens, decision makers, and experts to address issues of public importance, in this case, palliative care. The conferences involve a series of experts who deliver scientific evidence to a lay panel of 12 people before an audience. I might add that the use of consensus development conferences to address healthcare questions is not new, at least in Canada. There have been a number of examples in the past, and in particular, the Institute for Health Economics in Alberta has pioneered this model to address very specific questions around mental health, diabetes care, and other issues. The lay panel hears the evidence and discussions, and they take that into consideration when they develop a consensus statement which answers the predetermined questions. And as you know, there are 6 of them. The resulting consensus statement is then read to the experts and audience and are used to develop policy going forward. Ideally, very important policy that's currently under discussion, as Marcel alluded to. Palliative Care Matters has expanded on the traditional consensus development model and consists of 3 phases. Phase 1, which we're going to hear about in a few moments, is called Listening to Canadians. You are, I believe, are aware of the results of the Ipsos Reid survey, and for those of you watching online, those survey results are available on the website at palliativecarematters.ca, and obviously they will address what is important to Canadians. Phase 2 is the Consensus Development Conference today and over the next 2 days. And Phase 3 will occur shortly after this conference when the Conference Board of Canada will take the consensus statement, explore its implementation, its implications, consider how those recommendations might be implemented in the broader health system, and offer some advice and guidance. Palliative Care Matters is building on prior palliative care reports done by others in Canada. The 6 questions you see in your program were developed by the Canadian Reference Working Group, a group of national stakeholders and family representatives who reviewed the recommendations from various palliative care reports and completed over the last 20 years. From those reports, the working group identified the priorities that needed to be addressed and put them into the form of questions. And I might add, we'll be talking about the steering committee in a few moments for Palliative Care Matters, but I might add that a number of the members of the steering committee are part of the Quality End-of-Life Care Coalition, which is a very important coalition in Canada that, along with other groups, has provided a lot of the leadership and thinking that has preceded our organization of this program, and to them we are very grateful. So how will this conference look different and be different? Well, we began, of course, by hearing from Mr. Mulcahy. And that voice, Mr. Mulcahy's voice, and the voices of other patients and families are going to be forefront throughout the next couple of days. I'll be talking about how that is a little later. Certainly you'll see the participation of patients and families recognized in the formal proceedings, but you'll also be hearing from families and patients through videos and through quotations in their own words that will be displayed through various means over the next 2.5 days. We will be starting each major section of the program with a patient and family video, and I'll have a bit more to say about that later. And of course, in terms of the structure of the conference, it's organized by question. For each question, we have a scientific expert who has prepared a paper on the topic and will present the information to inform the lay panel and the audience. After each presentation, time is set aside for questions from the lay panel as well as the audience, both in the room and those that are following us online and through social media. When the conference finishes for us this afternoon, of course, the work of the lay panel is just beginning. They will be deliberating and discussing each question until they reach a consensus on how each question should be answered. So that's the night shift part of their work, which will begin later this afternoon. The same process happens on day 2, and then on Wednesday morning we will have the consensus statement read by the panel chair, who I'll introduce in just a moment. And after that statement, there's a brief period for you to ask questions of the panel about their findings and about their experience. So it's now time to meet the various groups who have made this initiative possible. I'm going to begin with the Steering Committee for Palliative Care Matters. About a year ago, when Covenant Health asked me to become involved with this initiative, we had a discussion about the need for this initiative to be led not just by one organization, but to share that leadership with a number of national organizations, many of them in which patients and families play a prominent role, to truly benefit from the thinking that has preceded this conference, but also to recognize that the task going forward after this conference is going to be very, very significant in the form of working to advocate for the recommendations and working with health systems to see them implemented. So we made a decision that we would form a national steering committee, and they are described in detail in your program. There are 14 organizations in total that have joined us to share in the leadership of the initiative. They include senior leaders in Canada's most prominent health organizations and very prominent family representatives as well among the steering committee group. Their involvement supports the shared goal of ensuring the Canadian health system is able to deliver consistent, high-quality, and evidence-based palliative care to Canadians now and in the future. I'm going to take a few moments to recognize the committee members, and when your name is called, if I could ask you please to stand so that you can be recognized. And ladies and gentlemen, I'll just ask you to hold your applause until I've recognized everyone on the committee. So you've already met Karen Macmillan, my co-chair from Covenant Health. The other members with us today, Sébastien Audette, President of Accreditation Canada International, Sharon Baxter, Executive Director, Canadian Hospice and Palliative Care Association, Dr. Jeff Blackmer, Vice President, Medical Professionalism, Canadian Medical Association, the Office of Ethics in particular, Dr. Heather Bryant, who's the Vice President of Cancer Control at the Canadian Partnership Against Cancer, Dr. David Henderson, who is the President-elect of the Canadian Society for Palliative Care Physicians, Anya Humphrey, a family and patient advocate, Maria Judd, Senior Director, Canadian Foundation for Healthcare Improvement, Tammy Moore, the Chief Executive Officer of the ALS Society of Canada, John Roots, the President and CEO of Catholic Health Sponsors of Ontario, Stephen Samus, Vice President of Programs, the Canadian Foundation for Healthcare Improvement, Marcel Saulnier, who you just met, Acting Associate Assistant Deputy Minister, Strategic Policy Branch at Health Canada, Shirley Sharkey, President and CEO of St. Elizabeth Healthcare, Anne Sutherland-Bowl, the CEO of the Canadian Nurses Association, and Jewel Buxa, the Project Manager for the Palliative Care Matters Initiative. Ladies and gentlemen, please join me in welcoming the members of our steering committee. There are 3 members who could not be here today, but I want to make note of their involvement and their support. Dr. Catherine Todd, who's the Vice President of Research, Innovation and Analytics at Alberta Health Services. Russell Williams, who is the Chair of the Canadian Frailty Network. And Shelley Jameson, CEO of the Canadian Partnership Against Cancer. Thank you very much to all our steering committee members and your support over the last many months. The other group, of course, that I want to take a moment to thank right now is our sponsors. Their support has helped us bring you this great event, and they've all been very generous with their support. I'll ask you to take a moment during the conference to thank them personally. Our sponsors are listed in the program, and you'll note they're identified on their name tags as well. Can I just ask all of the sponsors who happen to be in the room at the moment to stand together as a group, and I'll just run through the organizations represented. St. Elizabeth Healthcare, Accreditation Canada, the Canadian Medical Association, Health Canada, the Canadian Nurses Association, Providence Healthcare, Canadian Partnership Against Cancer, the Catholic Health Alliance of Canada, St. Joseph's Health System, Virtual Hospice, St. Joseph's Healthcare Society, St. Joseph's Health Centre in Sudbury, the Catholic Health Corporation of Manitoba, the St. Joseph General Hospital in Comox, British Columbia, and the Canadian Foundation for Healthcare Improvement. Thank you very, very much, ladies and gentlemen, for your generous support. And finally, just before we get to the introduction of our lay panel chair and the panel itself, I would like to recognize, you've already met Carleen Brenneis, Director of the Covenant Health Palliative Institute, and Dr. Conrad Fassbender, who is the Scientific Director of the Institute. These 2 individuals in particular have worked tirelessly over the last year and put up with me and other people in really bringing what is their vision on behalf of their organization to fruition. It's now my honor to introduce the chair of our lay panel, and he is someone who will be recognizable, I'm sure, to everyone in this room. Don Newman's depth of experience, expertise, and vast networks in media, politics, and business enable him to provide valuable strategic public affairs, communications, and media advice. He has also, over the years, and certainly in the course of my life, played a very important role in explaining to me and to my fellow Canadians the issues that confront our country, the perspectives of the decision makers and Canadians on those issues, and his own personal insight, which I can tell you has been invaluable, both as a listener of Don and as someone that had the opportunity to work very closely with him on this project. He is undisputedly one of Canada's most respected journalists and an award-winning public broadcaster. He's a member of the Order of Canada, a life member and past president of the Canadian Parliamentary Press Gallery, and he has numerous other honors, awards, and honorary degrees, too many to list in this introduction. In addition to being a public affairs consultant, Don Newman is a public speaker, an event moderator, a political commentator, and a recent author. His career memoir, Welcome to the Broadcast, was published by HarperCollins in 2013. Don, before I ask you to stand and introduce the lay panel, I'd like to personally thank you for saying yes to being involved in this project. I can't think of a more distinguished or trusted Canadian that I would have called upon to lead what I think is such an important, not only exercise, but an important debate, a debate that needs to be had in Canada like never before. Ladies and gentlemen, please welcome Don Newman.
Well, thank you, Fred. That's a very generous introduction, I must say, and I appreciate it. Before I introduce you to the lay panel, probably with the thought, of course, that health is both a provincial and a federal matter, I wanted to introduce, because I see him right before me, John Fraser. He is the member of the Ontario Legislature from Ottawa South. He is the parliamentary assistant, I think that's what they call you there, not secretary, parliamentary assistant to the Minister of Health, and he sent me a report. I didn't know he was going to be here this morning. Palliative and End-of-Life Care, the provincial roundtable report that he masterminded for the Ontario government. So, John, just stand up very quickly and let us welcome John Fraser. Now, it is my pleasure, of course, to introduce you to the lay panel. As Fred outlined, the work of the lay panel over the next 3 days is to prepare a national consensus statement which answers the 6 questions that you see printed in your program. Now, the lay panel members were chosen very carefully. Many individuals had been recommended to us. They had to complete a self-assessment questionnaire, and then we held interviews with each person. We needed a balanced panel, one that reflects as much as possible the Canadian population, balanced according to geography, both by province and rural-urban, by ethnicity, gender, age, with some having experience in healthcare and some having experience in palliative care. In addition to ensuring the panel was balanced, each person on the panel needed to be independent and neutral, that is, non-government and non-advocacy groups. They needed to be able to weigh the evidence, be capable of collaborative work, and be good thinkers. Now, we know that's true, but we're going to really ask them to prove that over the next couple of days, but that's the way we're billing you now. We're pleased to tell you that the panel does meet these criteria and more. This is a volunteer panel, and we're particularly grateful that these panel members have agreed to give their time, their talents, and skills to contribute to this important initiative. I will introduce each panel member briefly. Their full bios, of course, are in the program and also on the website. I will ask each lay panel member to stand as they're being introduced. You don't have to stand all the way through. You can sit down again as soon as I go on to the next person. But let's begin here on the bottom row, and let's begin with Penelope Hedges. She is a chartered accountant specializing in IT work and is used to managing multidisciplinary teams at the highest level. Ms. Hedges was the sole caregiver to a former partner who died of colon cancer in 2010. In 2012, Ms. Hedges was diagnosed with ovarian cancer. She is a patient and family representative on various committees in British Columbia. Thank you, Penny. The Reverend Dr. Mark Jerry is an ordained Lutheran pastor, university professor and economist, and he is from Red Deer, Alberta. As a spiritual care provider, Dr. Jerry brings experience as a palliative care chaplain at St. Paul's Hospital in Saskatoon as part of a comprehensive palliative care medical care team for terminal patient cases. Dr. Jerry also has ongoing experience with matters of end-of-life care while acting in his role as a clergy in the palace. Thank you. Rosella M. Kinoshameg is an Ottawa Ojibwe from the Wikamekong unceded First Nation territory. She is the recipient of a Doctor in Sacred Letters, Honor Cassia, Regis College, University of Toronto. She was also recently recognized with a Pro Ecclesia a Pontifice Medal, an award conferred by the Pope to the laity for distinguished service to the Church. Over her 48 years of nursing, she has sat on a wide variety of health committees and boards and held a number of roles from practice to teaching to advocacy for a wide range of health areas, including palliative and end-of-life care and hospice care. She is presently working on palliative care policies and procedures for the Wikiwekong Long-Term Care Home Community Care Program. Thank you, Rosella. Ghislaine Savoie is a Canada Council doctoral fellowship holder. He has taught political science and international relations at the Universities of Ottawa and Moncton. He has also been a member of the Federal Department of Communications and also the Department of Canadian Heritage. After caring at home for his son, who passed away of cancer, Ghislaine was involved with a team of palliative care specialists and volunteers in creating a palliative care hospice named after his son, La Maison Mathieu Fromont-Savoie, which now flourishes in Western Quebec. Thank you. Marisa Lepage. Marisa grew up in Saskatchewan's Francophone community and now lives in Ontario. She is a speech-language pathologist as well as a medical doctor and is currently on maternity leave from her residency in psychiatry. Dr. Lepage has been passionate about palliative care for many years, first as an allied health team member who witnessed the undeniable need for palliative and end-of-life services, and then as a medical student in palliative care units and on the road with home care palliative physicians. She hopes one day to offer psychiatric services as part of a psychosocial oncology and palliative care team. Melissa, thank you. Now let's go to the second row and start with Carrie Stewart, who is a retired supervising principal and student success leader, and a former member of three expert panels in Ontario education. Ms. Stewart has had personal experience with palliative care of 2 family members and a friend. Currently, she is a volunteer member of the Patient and Family Advisory Committees at the Kingston General Hospital and the Regional Cancer Centre in southeastern Ontario. Carrie, thank you. Earl Campbell. Earl is from Ontario and a retired Director of Education and CEO at the Scarborough Board of Education. He has experienced palliative care with his father, mother, aunt, and a friend, and counsels seniors about care through his church. In addition, he has presented to community groups about the importance of advanced care conversations and planning. Earl, thank you. Serena Lewis. Serena is a registered social worker in a community-based hospice, as well as a workplace educator in Nova Scotia. She, along with a dedicated volunteer board, established a community-based hospice in Truro, Nova Scotia. She is passionate about hospice palliative care and believes that all Canadians and their families deserve an exceptional dying experience. Ms. Lewis has counseled families and individuals through the process of dying and is a strong advocate in issues related to the social, emotional, financial, and spiritual impacts of dying. Serena. Ahmad Sabed Gahadam. Ahmad is an educator, researcher, program and community development consultant, an expert on bridging cultures, a CEO of small business, and a small business mentor. He also has a PhD in international intercultural education from the University of Alberta and has also completed the Small Business Mentorship Program. For the last 8 years, he's been the CEO and operates the first Persian restaurant in Edmonton, serving only home-style cuisine from Persia. And we're all going there for lunch when we're in Edmonton. Ahmad, thank you. Penny Erickson. Penny is the former Dean of Nursing and a Professor Emeritus at the University of New Brunswick, who now acts as a family experience advisor in the province. Ms. Erickson has spent 7 months in an acute care setting with her husband before he died in 2013. This demonstrated to her the need for efforts both from the healthcare provider and from patients and families to improve care by enhancing safety and civility. Penny's goal is to ensure that patients, families, and staff feel cared for within the healthcare system. Penny. And Kenneth MacDonald. Ken is a professor of geography and planning, University of Toronto, cross-appointed to the Centre for Diaspora and Transnational Studies and the Centre for Critical Development Studies. His interest in palliative care came as a result of his mother being diagnosed with terminal uterine cancer, and she needed help to fulfill her wish to die at home. The 6 months that he has spent with his dying mother opened his eyes to the magnitude of the problems faced by patients, practitioners, and our healthcare system. Thank you, Ken. So now all together, let's join in thanking the lay panel for agreeing to play this very significant role in the conference. Now, Fred, as you know, the lay panel has been reading and preparing for the conference for the last month, and we are fully prepared and ready to listen to the experts, to ask questions, and benefit from the questions and answers from you, the delegates, and to begin writing the answers to those 6 questions. The lay panel, I can speak for them all, feel incredibly proud and humbled to be part of this extremely important initiative that has the potential to change the care and services that people receive at the end of their lives. Thank you very much.
Thank you very much, Don, for introducing your colleagues. And ladies and gentlemen, at this point, ladies and gentlemen of the panel, the rest of the program is devoted to you, and we're going to get right into the evidence that has been prepared for you. And most importantly, we're beginning with the evidence as represented by the views and lived experiences of Canadians. Aaron Ralston, Vice President of Canadian Public Affairs for Ipsos, has been involved in public opinion and marketing research for over 20 years in Ottawa, Toronto, and Calgary. She's extremely experienced in managing all aspects of both quantitative and qualitative research projects, and there is a note here indicating that in her career she has conducted over 1,000 focus groups, and I can't imagine what that must be like. So Aaron is here to present the results of some research which has been made available to you. We are, as Aaron makes her way to the stage, I will tell you that we are going to try and pick up a little bit of time. Ladies and gentlemen, we're working toward giving you a break at 10:15. And of course, because of our web audience, we must start each portion of the program on time so that they can join in. So without anything further, welcome Aaron.
Thank you.